testosterone levels in men are dropping at an alarming rate for a bunch of different reasons. My mood is great, I sleep well. That's your number. Then you have the next guy with the same number who says, I feel like death, I'm depressed, I'm gaining weight, I have no sex drive, my brain doesn't function. The test, right? So the arrogance, right, to say, well, if I don't know something, then by definition, it's nonsense. Wait a minute. Educate yourself. What's up, everybody? Welcome to No Limits with Dr. Thierry Jacquemin. I'm Dr. Thierry Jacquemin. I'm a board-certified internist. I deal primarily with wellness, with performance, and obviously it all ties in with hormones, right? So today, in this little interlude, we're going to be shattering some myths, debunking some stuff, because we're in an age where finally things are being democratized a little bit in my profession. But there remains a lot of misunderstanding from what I see, both on the sides of patients and both on the sides of physicians, right? So we're going to try to sort of claw through some of the dirt, some of the stuff that isn't real, right? Because this is an age, obviously, where there is an abundance of information, but it's not all good information, okay? So I'm here to tell you, get a little closer, listen a little more. Just because you read it on Google doesn't mean it's true. This is a podcast, so I'm going to say this too. Just because you hear it on somebody's podcast doesn't mean it's necessarily true, okay? So that old quote that I live by, trust but verify, okay? Regardless of your source. Why are we going to talk about this? Very simple. The amount of hormones by volume that are in your body at any given time can fit in about a little teaspoon. But these very powerful molecules do everything and anything in the body. They regulate your mood, they regulate your health, they regulate your longevity, they regulate to some extent your risk of developing certain diseases, certain cancers, certain degenerative diseases. They regulate your bone density, they regulate your metabolic machinery, so on and so on and so forth, okay? So that's why it's such an important concept. That's why for something so powerful, it's basically like you're, sort of tinkering with nuclear weapons, right? And so it's very, very, very important that you understand it for yourself first, for what it can do and what it should do to your health. And it's very important from the side of practitioners, right? I've seen it sort of on both extremes, right? I've seen some physicians basically turn patients away and say, oh, whatever you've heard about hormones, whether it be testosterone, this and that, not true, don't worry about it. Basically, the idea that, if you're alive and you're taking 3 steps and you're not dead, then your hormones are fine or, normal. Well, let me ask you this, right? Without getting weird and esoteric, what the hell is normal, right? Let's start with that. Let's start with what a lot of people will tell you, what a lot of physicians are going to tell you, that, your hormones are normal, right? That's if they even test them, right? So I hear this from patients on a daily basis that it took them a year, 2 years, 3 years to even convince their physician to even just order the test, right? So the arrogance, right, to say, well, if I don't know something, then by definition, it's nonsense. Wait a minute. Educate yourself, as I say, right? So back to the concept of normal hormones. There's no such thing as normal hormones. If you go get your, actually this applies for any lab value, but particularly for your hormones. Let's say you're going to go get tested and you're going to get a number, whatever that number is, right? And then the lab is going to report that number, and then they're also going to report a range, right? From a low number to a high number. So let's just use as an example, which is very applicable because we deal with it on a daily basis. Let's use as an example testosterone, right? There is a range reported by the labs of roughly, lab by lab varies a little bit, but roughly 300 to 1,000. Forget the units, doesn't matter for this discussion, right? So then You could be at 301 or you could be at 999, right? And then somebody who doesn't know any better is going to look at that number and say, oh, well, it's normal. So we're saying that 301 or 999 is the same thing. What I tell people every day is imagine that that's your bank account. Would you rather 301 or rather 999? I think the choice is pretty simple, right? So take that another step. The range that a lab reports has absolutely nothing to do with your ideal number as an individual. I'm going to say it again. The number reported by the lab, and this goes for any lab, has zilch to do with what the ideal number should be for you. The number that should be for you, again, we're back to testosterone. This applies to thyroid, which we're going to do a whole other segment on that at another time. It applies to all your other hormones, but it's very salient with testosterone. And by the way, for men and women, right? So don't think if you're a woman that this doesn't apply to you. It applies to you directly and indirectly, right? Number one, because you have testosterone in your body. Number two, because you're for sure interacting with somebody who has testosterone in his body. So it behooves you to understand that better. So back to the range. What matters is not where you fall in that range. What matters is whether that number is ideal for you. Very different. So you can have literally side by side, three people, and these three people have the exact number to the decimal point. And those three people might be going through a very different experience in life. One guy might have a number that's right in the middle, and you might feel great. And you say, well, you ask him, and he says, well, I have sex 19 times a day. I work out 47 times a week. I'm lean, I'm fit, I'm happy, my mood is great, I sleep well. That's your number. Then you have the next guy with the same number who says, I feel like death, I'm depressed, I'm gaining weight, I have no sex drive, my brain doesn't function, blah, 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 blah. And then the third person will be completely at the other extreme of that. So again, let's go back a little bit, right? I'm going to give you like a very tiny little bit of scientific background here. The way these numbers are derived, that every single lab will give you, very simple. They take the data for every single patient that gets tested for that lab value, right? Within a time frame, a year, 2 years, whatever it is, and they make what's called a bell curve. A bell curve is a man-made construct where you agree that 90% of people are going to fall under the curve, and then you're going to have a small subset of outliers that are on one extreme, on the other extreme. Great. So you get your number checked, and then the lab gives you a number, the lab gives you their range, and now you say, well, this is where I fall compared to the population. The thing is that, I don't know about you, but I don't really care where the population lies. The only thing I care about is what's optimal for me. Now, to optimize that for yourself, there's a lot of different factors. Some of it is related to your lifestyle. It's related to what kind of stress you're under. It's related to your routine. Some of it is genetic. Some people naturally do better with higher numbers or different ratios than other people. Some people do perfectly fine otherwise, right? If you're spending 16 hours of your day sleeping and your demands are very little, you really shouldn't be doing that. But let's just say you are. Your demands for testosterone are probably going to be very different from the demands of a Navy SEAL, right? Who at any given time on a mission can be shot without warning, right? So the point is that, back to what I always say, you have to personalize it. You have to individualize it, okay? That's the key point. So again, if you go and, with all the respect in the world, if you go and you have a consultation with somebody who tells you your number is normal, I encourage you to politely give them the finger and then go look for somebody else, because that person doesn't understand a bloody thing about hormones. Now, again, with all due respect, if you don't understand it, that's perfectly fine. Don't manage it, don't check it. Just send people to people who actually get it, right? Because the distinction of what that will mean, the meaning of that from the standpoint of your life, your quality of life, your health, your longevity, your performance, blah, 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 is completely different. I'm going to give you a little extra nugget on testosterone, right? I ask this question daily of different people with different knowledge bases, and I rarely get the right answer. There are receptors that deal with hormones. Receptor is nothing more than a lock And the hormone is basically like a key that enters, binds, causes a reaction, and then does all the stuff that we expect testosterone to do or any other hormone, right? So I ask this question all the time. What is the organ system in the body that has the largest amount of receptors that are specific to testosterone, meaning receptors that are only there to manage that one hormone? And usually the answer I get is, the penis, the testicle, the right testicle. No, it's the brain, followed by a close second by the heart, right? So your mood is affected by optimal levels of testosterone, your productivity, your cognitive function, your decision-making, the way that you handle the stressors of life, the way that you recover from the stressors of life, the way that you recover from sleep. So what that means is that testosterone is pleiotropic. Testosterone is a lot more than what people think. It is a lot more than sex and muscles, right? It does sex and muscles great, awesome. We know that, right? Pretty much anybody. You can ask your average 5-year-old walking down the street, which you probably shouldn't do, but you can ask them and they're going to say, yeah, it's probably something to do with getting jacked and having more sex. Phenomenal. But that's not the point. The point is that there are a lot of other things that you can optimize. We're going to be doing a lot of series on testosterone, on the details, on the ratios, on the intricacies, on all this other stuff, on the fact that testosterone levels in men are dropping at an alarming rate for a bunch of different reasons, which I will be giving you. So pay attention to that, because that will blow your mind, okay? So I encourage you to like it, to share this video, to subscribe to the channel. Hopefully you liked it. Hopefully you got something out of it. If you didn't, still like it, still share it, still send it to somebody who might benefit. If you don't want to watch another one, then don't watch another one. But I encourage you to at least send it forward. Give me some feedback. You can message. I'll answer fairly quickly, and we can engage, because I want feedback. And ultimately, we're trying to build a community of awesomeness here. I want to thank my partners and the sponsors here: Power Boost, Smart Invest, Jungle House Studios, and Luxe Galore. See you later, my friends.